I felt I knew how to cure people. But for a long time, if I could not cure a person, I could not make them better, I didn't want to know about their problems. I only wanted to fix people. I'm Mr. Fix-It. And so when she introduced me to a great way of relieving that problem by saying, all you need to do is listen and care about an individual, to provide compassionate listening and presence, that was a great relief for me, because I had avoided people who I could not help. I had avoided people who died or close to death. I had avoided their families, not knowing what to say, not wanting to offend.
A lot of the stress that I think clinicians experience in healthcare, besides external stress of where healthcare is right now, is the stress of not being able to show your humanity to each other. It's the stress of having to be on some sort of stage of convincing your colleagues and your patients that you're perfect and you have no brokenness. I mean, I've actually had colleagues say to me, I cannot possibly show any ounce of emotion or any ounce of suffering because my patient will see me as weak and won't trust me. And in fact, the data shows it's just the opposite, that if we can show who we are as human beings, that we are broken people too, all of us have experienced loss and suffering to some degree, and it's through that experience that we can have a window into an opportunity of healing for both our patients as well as ourselves.
By making this connection, especially done in an efficient way, it adds a level of a relationship with the patient that is protective. I know what our lawyers feel, and they feel very strongly, the lawyers for the university feel very strongly, that making those connections is the difference between doctors who get sued and doctors who don't. And that we know very clearly.
I was so happy to find her, because before I got an appointment with her, I was so frustrated and so tired of them, you know, like every comment they had after a phone call with me was like, maybe you should follow up with your psychiatrist. So I was so tired of that I was thinking of just giving up and just living with the symptoms, you know, and that would have killed me.
Dr. Puchalski paid attention, and she cared. And the other doctors, you know, I don't know that they didn't care, they just don't pay attention, or they don't think that you know anything about your own body. When we were going through all this, before she ever was diagnosed, she says, "Oh, I've got a brain tumor." Mary did, which was to me amazing when it turned out that's actually what it was.
She said, "You don't look depressed, you don't act depressed, you know, we'll find out what's going on." And I felt like finally someone was listening to me and we'd actually figure out what was really wrong and get to the bottom of it. It's definitely been a blessing that I found her. And yeah, it probably did save my life.
Hi, Miss Fletcher. How are you?
We have to recognize that we have a call to serve and to keep that call alive in our own lives. So that if each healthcare professional can do that, can first of all say, I have been called to serve, and I will not do anything less than that. And the minute something interferes in that call, I'm going to make that change. So it's one person working on themselves. Strive every day to continue to maintain that call. I think the system will heal on its own. It really stems from each one of us doing our work with integrity and authenticity. And that's the same thing with our patients.
How's your foot? Is the main thing. The big deal that happened, you know, the first surgery.
I just get so moved. I mean, to hear their stories and what they go through and how they're able to survive and face each day with such grace and dignity is awe-inspiring to me.
You must have been a wonderful pediatrician.
Oh, I think I was.
Yeah. Yeah, I see my life as this path that I'm on, and people come in and out of the path, but even when they're not physically on the path, I mean, once I've been with them, they're always with me. And so it's this enormous path, you know, and, you know, these interactions are profound.
Okay. He doesn't drive anymore. My mother drives.
Ale pan bardzo dobrze mówi po polsku.
Is your appetite not good, or do you have difficulty swallowing?
Good.
Okay, so what is it then?